Do you know that right now inside your body, there might be a ticking time bomb? It doesn't make a sound, cause any pain, or leave any clear signs. Yet day by day, it silently tightens your blood vessels, weakens your heart, attacks your brain and kidneys, and leaves behind hidden damage on every cell. At some point, when this bomb explodes, the consequences could be a sudden stroke, a heart attack, or even instant death. The scary thing is that millions of people live with this bomb completely unaware. And the enemy, high blood pressure, is the cause. It's no coincidence that high blood pressure is called the silent killer, because by the time you realize it, it's often too late. In today's video, I'll share 5 shocking but extremely important facts about this disease. Be sure to watch until the end, because just one small piece of information could save you or a loved one from a health catastrophe. The first truth, the silent killer. High blood pressure rarely has clear symptoms. Have you ever heard of a disease that can attack you for years without a single alarm? No pain, no fever, no cough, no distinct symptoms. That's high blood pressure, the silent killer. It quietly creeps into your body, day by day eroding your blood vessels, weakening your heart, and preparing for a sudden strike, a stroke, a heart attack, or irreversible kidney failure. And the terrifying truth is, most of us don't realize it until the disaster has already struck. Many people think, I feel fine, so I must be okay. But this feeling of being okay is a deadly trap. High blood pressure often progresses silently over decades. You can go to work, go for a walk, laugh, and enjoy life without knowing your blood pressure is slowly rising. Then one day you might collapse at the dinner table or suddenly lose consciousness on the way to work, and by then it's far too late. Some people might experience vague symptoms when their blood pressure is very high: headaches, dizziness, blurred vision, or nosebleeds. But remember, these are not reliable early warning signs. On the contrary, they often appear only when the condition is severe, sometimes right before a stroke. In other words, waiting for symptoms to detect the disease is like gambling with your own life. The reason high blood pressure is called the silent killer is that while you feel nothing is wrong, the high pressure is secretly damaging your vascular system. Every time blood is pushed through with excessive force, the vessel walls get slightly worn down. Over time, they become stiffer, thicker, and less elastic. This is the beginning of atherosclerosis, where plaque builds up, narrowing the vessel and making blood flow more difficult. At the same time, your heart has to work harder to overcome the increased resistance in the blood vessels. Like a pump pushing water through an increasingly narrow pipe, the heart gradually becomes enlarged and the muscle wall thickens. Initially, you don't feel any difference, but over time, the heart gets tired, weakens, and can eventually lead to heart failure. All these changes happen silently, little by little, like a thief in the night stealing your health without leaving clear traces until it's too late. That's why relying on a feeling of good health to gauge your blood pressure is a fatal mistake. The second truth, the blood pressure classification spectrum, it's not just normal or high. When people talk about blood pressure, they often think it's a simple case of either being normal or high. But the reality is far more complex. Blood pressure is like a multi-level measuring stick, and each level tells a different story about your cardiovascular health. If you only see things through a good or bad lens, you'll miss crucial early warning signals. According to the American Heart Association's guidelines, blood pressure is divided into clear categories. The optimal level is always below 120/80 mmHg. This is the gold standard, a sign of a healthy cardiovascular system with a low risk of complications. If you are in this range, congratulations, but don't become complacent. Maintaining these numbers for the long term is the real challenge, especially as you age, gain weight, or adopt an unhealthy lifestyle. When you reach the normal range, with systolic pressure from 120–129 mmHg and diastolic from 80–84 mmHg, many people still feel safe. In reality, this is already a sign that your blood pressure is trending upward. Without lifestyle changes, you will likely move into a higher risk category in the future. And that's the elevated blood pressure group with readings from 130, 139, 85, 80 mmHg. This is considered the yellow light zone, meaning you're not yet diagnosed with high blood pressure, but your body is sounding an alarm. For those with additional risk factors like diabetes, obesity, smoking, or a family history of cardiovascular disease, this level will almost certainly lead to full-blown hypertension without timely intervention. Once you cross the 140/90 mmHg threshold, you are officially in the hypertension group. From here, the risk of stroke, heart attack, heart failure, kidney failure, and eye damage increases significantly. Even more serious, many people are only diagnosed when they are in stage 2 hypertension, with a systolic pressure of a 160 mmHg or higher, or a diastolic of 100 mmHg or higher. At this stage, lifestyle changes are not enough, and medication is almost always required for control. In some special cases, blood pressure can spike to 180 or 120 mmHg or higher, which is known as a hypertensive crisis. This is a medical emergency that can cause damage to the brain, heart, and kidneys within hours and requires immediate treatment in a hospital. So, each blood pressure level isn't just a lifeless number on a machine, it's a warning on a ladder. Each step up means the risk of cardiovascular disease, stroke, and a decline in overall health increases significantly. Understanding which step you are on is the first move toward adjusting your lifestyle, preventing complications, and protecting your long-term health. The third truth, the numbers game. Don't ignore either reading. Imagine you're driving on a highway. You look at the dashboard and see the speedometer at 60 mmHg. You smile to yourself thinking, I'm good, not too fast. But if you only look at that number and ignore the fuel gauge or the engine warning light, are you truly safe? Our blood pressure is exactly the same. One single number cannot tell the whole story. Every time you take your blood pressure, there will always be two numbers. The top number, called systolic pressure, is like the speed of the car, indicating how hard your heart is contracting to pump blood throughout the body. The bottom number, diastolic pressure, is like the road beneath the wheels. Even when your heart is resting, blood still has to flow through your vessels. And this pressure level reflects the durability and elasticity of your vessel walls. Yet I've met many women over 60 who say, the doctor said my blood pressure is 120, so it must be fine. But 120/75 and 120/95 are two completely different pictures. With 120/75, you are safe, but 120/95 shows that your diastolic pressure is high, meaning your blood vessels are under significant pressure even at rest. If this condition persists, it silently damages the vessel walls, forces your heart to work harder, and can lead to atherosclerosis, heart failure, or even stroke. It's crucial to note that women over 60 often have significant hormonal changes, especially after menopause. The decline in estrogen makes blood vessels less flexible and more prone to hardening, which is why the risk of high blood pressure increases so rapidly. Many women who have had normal blood pressure their whole lives suddenly discover their numbers have risen in old age without any prior warning. Furthermore, blood pressure doesn't stay in one place. It fluctuates throughout the day, rising when you're stressed, dropping when you're resting, and even changing because of a single salty meal. Therefore, a single measurement cannot accurately reflect your true condition. Doctors often recommend measuring blood pressure multiple times a day, at different times, or even using a home monitor for long-term tracking. In other words, both blood pressure numbers are equally important. A good reading on one doesn't erase the risk from the other. So if you are a woman over 60, remember that the next time you take your blood pressure, don't just remember the 120. Look at both numbers, because sometimes it's that small number at the bottom that determines the safety of your heart. The fourth truth, a lifelong journey. Managing high blood pressure is a forever commitment. When they are diagnosed with high blood pressure, many people have a common thought: I'll take the medication for a while, and when my blood pressure is normal, I'll be cured. But this is one of the most dangerous misconceptions. High blood pressure isn't like a passing flu that can be cured with a few days of medication. It's an uninvited companion, and once it arrives, you must learn to manage it for the rest of your life. Think of high blood pressure as a rushing river. Without a dam, the flow will break the banks and wash away villages. Medication and a healthy lifestyle are the dam that controls the water. But if you remove the dam, meaning you stop taking your medication or abandon healthy habits, the river will immediately rush back, sometimes even more powerfully than before. This is a rebound hypertension phenomenon, where blood vessels that have grown accustomed to the support from medication are suddenly left to fend for themselves, causing blood pressure to spike. The danger is that this spike is often unannounced, potentially leading to a stroke, heart attack, or acute heart failure in a very short time. Clinical records show many cases where patients, after a few months of treatment, felt their blood pressure was back to normal and decided to stop their medication on their own. Just a few weeks later, they were admitted to the emergency room with severe complications. This shows that stable blood pressure numbers do not mean the disease has disappeared. It simply means that the medication and lifestyle changes are successfully controlling the condition. If you remove that protective barrier, the disease will return, and it may be even worse. It is important to note that high blood pressure is a chronic disease, just like diabetes or hypothyroidism. This means you cannot cure it, you can only manage it. Blood pressure medication is designed to reduce the heart's workload, dilate blood vessels, eliminate excess salt and water, or slow the heart rate. All of this is aimed at keeping your blood pressure stable in the long term. But to maintain this effectiveness, you need to take your medication regularly, at the correct dosage, at the right time, and never stop without your doctor's approval. In other words, stable blood pressure is not a sign of being cured, but a result of the treatment working. And it is this consistent combination of medication with a low-salt diet, regular exercise, adequate sleep, and stress management that is the key to living a healthy life and avoiding dangerous health events in the future. The fifth truth, the ripple effect. High blood pressure damages your entire body. If you think high blood pressure is merely a matter of the heart or blood vessels, the truth is far more severe. Imagine throwing a pebble into a calm lake. Initially, there are just small, seemingly harmless ripples, but over time, those ripples spread across the entire surface. High blood pressure is the same. It doesn't stop at the numbers on the monitor. It creates a widespread chain of effects that silently attacks almost every organ in your body. First is the vascular system, the first line of defense. When blood is constantly flowing under high pressure, the vessel walls are worn down continuously, like a pipe being scoured. The inner lining, called the endothelium, is gradually damaged, creating a perfect environment for cholesterol and plaque to accumulate. This is the foundation of atherosclerosis, a condition where the vessels narrow, obstructing blood flow to organs. Not only that, but weakened vessel walls can also balloon out like an overinflated balloon. When that balloon ruptures, the result can be a brain hemorrhage or an aortic rupture, events that are almost always life-threatening. Next is the heart. This organ has to constantly pump blood against the resistance in the blood vessels, like a pump working at maximum capacity to push water through a narrow pipe. At first, the heart muscle thickens, a condition called left ventricular hypertrophy, like a bodybuilder gaining muscle. But in the long run, the heart cannot bear this burden. The heart chambers stretch, the pumping force weakens, leading to congestive heart failure. Patients begin to feel fatigued, short of breath, and have swollen legs. They may even be unable to lie flat to sleep due to a feeling of suffocation. At the same time, when the coronary arteries are narrowed by atherosclerosis, the risk of angina and heart attack increases, events that can claim a life in minutes. The brain is also a major victim. High blood pressure is the leading cause of stroke, both ischemic strokes from blood clots and hemorrhagic strokes from a ruptured blood vessel in the brain. A stroke can leave devastating consequences: paralysis on one side of the body, loss of speech and memory impairment. Beyond that, prolonged lack of blood flow in the brain also contributes to vascular dementia, causing a gradual decline in a person's ability to think and a loss of memory, which directly impacts their quality of life and independence in daily activities. The kidneys, the body's sophisticated filters, are also destroyed. Millions of tiny blood vessels in the kidneys are responsible for filtering waste and balancing fluids. But under high blood pressure, these vessels are progressively damaged, weakening their filtering ability. The result is chronic kidney disease, a silent but dangerous illness. In its final stages, patients must undergo dialysis or a kidney transplant to survive, a difficult journey that is taxing both physically and financially. The eyes do not escape either. The tiny blood vessels in the retina are extremely sensitive to high pressure. Prolonged high blood pressure can lead to hypertensive retinopathy, causing bleeding in the eyes, optic disc swelling, blurred vision, and in many cases, permanent blindness. You see, the 5 truths we've just explored aren't meant to scare you, but to empower you to take control of your own health. High blood pressure is truly dangerous, but the good news is that it can be completely managed if you know how. First and foremost, never underestimate the numbers. Regular blood pressure checks are non-negotiable. A home monitor can be incredibly useful because you can track your readings in a familiar environment, avoiding the anxiety often experienced in a clinic. But remember, rest for at least 5 minutes before measuring, sit up straight with your feet flat on the floor, use a cuff that fits your arm, stay quiet, and record the results regularly. In addition, lifestyle is the foundation. A healthy diet, such as the DASH diet, rich in vegetables, fruits, whole grains, lean protein, and low-fat dairy, will keep your heart and blood vessels healthy. Limit unhealthy fats, cholesterol, and especially salt. Ideally, your sodium intake should be under 2,300 milliliters per day, and if you already have high blood pressure, try to keep it under 500 milliliters. Conversely, adding potassium from bananas, potatoes, spinach, beans, or yogurt can help balance the effects of sodium. Physical activity is also essential. A 30-minute brisk walk every day, or 150 minutes of moderate exercise per week, plus a few muscle strengthening sessions, will help lower your blood pressure significantly. If you are overweight, even a small amount of weight loss can make a difference. Limit alcohol, stay away from tobacco, and learn to manage stress through meditation, deep breathing, yoga, or simply spending time in nature. And finally, don't forget to partner with your doctor. Share your risk factors with them, monitor your numbers closely, and if medication is prescribed, take it exactly as directed. Never stop or change your dose without professional medical advice. High blood pressure may be silent, but you are fully capable of taking control as long as you are persistent, proactive, and know how to listen to your body. We've just explored 5 important truths about high blood pressure together, from its dangerous silence in the real meaning of the numbers to how to control it long term. Understanding these facts isn't meant to frighten you. It's to show you that the disease can be completely managed, and you hold the key to protecting your own health. Remember, high blood pressure isn't the end of the road. It's simply a reminder for us to live more disciplined lives and pay closer attention to every small habit. From regularly checking your blood pressure, to eating a balanced diet, exercising daily, and staying calm and working closely with your doctor. Every step you take today is a solid brick building your health for tomorrow. If you found this video helpful, don't forget to press like to show your support, subscribe to the Senior Health Guide channel to join us for future videos, and share it with friends and family, because sometimes just one small piece of information can save the life of someone you love. Thank you for watching until the end. I look forward to seeing you in our next segments, where every bit of knowledge is a step toward living a healthier and safer life every day.